Nutrition is just at the core of a lot of these problems. So if we can target that first or address it as a primary factor in your health care, we're doing our job. I'm Dr. Bobby Tassin, and I'm a supervising physician for Healthy Heart Clinics. So nutrition we can talk about for days. For better or for worse, it's probably the main determinant of our overall health over the span of our life. So nutrition is important to different people for different reasons. You may have someone who's on a fixed income and has food insecurity and they can't afford healthy foods. You may have a person with diabetes who has to really watch their sugar and carbohydrate intake, hypertension, watching their salt intake. Same for congestive heart failure patients. Kidney patients may have limitations on several things, including salt intake and fluid intake. For most of us, nutrition challenges, we have too much of good food in South Louisiana and in the Western world in general. And our diet has created epidemics. A lot of the type 2 diabetes directly relates to people gaining weight over the span of their lifetime, and that directly relates to what we eat, how much we eat, and how active we are. So nutrition is going to be primary to any aspect of a person's health. If we look at nutrition and the importance, from a common denominator, what makes sense for most people, the key is balancing what we eat and our caloric intake, how many calories we eat, with our activity level to try to attain and maintain a normal body size. BMI is an abbreviation for body mass index. So obesity relates directly to so many illnesses and contributes to so many illnesses that are common. Hypertension, the development of heart disease over the time, peripheral vascular disease, diabetes, certainly, sleep disorders and pulmonary issues, and even orthopedic musculoskeletal issues. If you're carrying around excess weight, you're going to put more stress and strain on your joints and have more aches and pains and back pain. So the most common factor is going to be our carbohydrate intake and salt intake in the Western world. So obviously avoiding simple sugars, sweets, sodas is important. And then the carbohydrates that we eat in many of our meals, including bread, rice, potatoes, and pasta. These items elevate our blood sugar level, elevates our insulin levels to try to control that. Why Healthy Heart Clinics? Because all of the common problems that we're going to try to diagnose, treat, and prevent. We want to look at what you eat currently and counsel you on what better choices you could make. We want to stress the importance of caloric intake versus activity. If you're really into it and you want to get more detail, there's things called CGMs, continuous glucose monitors. So you can slap a device on your arm or your abdomen. It can output your blood sugar readings to an application on your phone, and knowledge is power. So you can see if you're eating well or if you're eating something that may not be healthy. You can see what effect that has on your blood sugar. So it's a state-of-the-art method to learn about what your activity does versus your diet and how that affects your blood sugar control. And it can keep you from getting close to developing disease. So personalized nutrition is going to be a combination of evaluating what your dietary preferences are, suggesting something that would be healthier in lieu of that, learning about the basics of, again, numerical caloric intake versus numerical calorie burning. There are some genetic testing that can assist as far as your nutritional intolerances, and that, again, is a late-breaking evaluation that we will learn more as we go along how to apply it to patients and have a more data-based approach of what foods may be better for you or what foods your system will not tolerate as well. Nutrition is just at the core of a lot of these problems. So if we can target that first or address it as a primary factor in your health care, we're doing our job. Thank you for watching this video, and for more information, you can go to healthyheartclinics.com.